5:30 p.m. I'm calling to order the Wednesday, June 9th, 2021 Public Safety Events and Quality of Life Committee meeting. I'm the chair, Mike Stefano. I am joined in the dais by council members Bill Scott and Don Braceland. Please remind everybody that if you're going to make a comment tonight to come up to the mic. And do you still have to push the button? Yes, you have to push and hold down the button so that we can be recorded. Please state your name and address for the record. Okay, item number 2 is comments, suggestions, petitions by residents in attendance regarding items that are not on the agenda. I see none. Okay, we'll move on to item number 3, which is our fire department report. Do we have Chief Pelna? How are you?
This is great to be in person.
Yeah, I wasn't sure I recognized you. You didn't have a mask on. So.
Yeah, right. Our report for this month, back in May, all the way back, 101 calls. We had 3 significant incidents during the month. We were assisted by Good Fellowship Ambulance and also the police department on both of those. Building fire on Market Street. Also, Kevin and his team were out as well in the borough. We had an electrical issue that spread between a few addresses there. Also, house fire out in East Bradford on 52. And then at the end of the month on the 30th on College Avenue, just west of the university, we had one as well. What we're finding, our false alarms are going down. They're actually trending in a downward fashion, so that's great. Just 2 years ago, we were up around 50%. Don't know yet if that's completely associated with COVID or if some of our ordinances, not only in our entire coverage area, are changing. If you don't know, West Goshen added one as well recently. So we're working through that. And if anybody noticed, we got a little rain in the last day. So we had 13 calls for service yesterday, 2 water rescues, which were mutual aid, and then 1 this morning where we assisted Good Fellowship as well. Big news with the closure. We're working with all the departments for a training event this Saturday morning from 8 to 11 uptown. We're going to be closing the 100 block of East and the 100 block of West. And we're going to do something similar to what we did last year. Take all of our lessons learned from our previous plan, put them into action, and work with our partners to give that a go. So everybody's invited to come out to that. But 8 o'clock on Saturday, we're going to be shutting down again. We're going to start out with the 100 block of West, and then we'll do the 100 block of East. We should be wrapped up by 11 o'clock, hopefully. Any questions?
None from here. Anybody have anything for the fire department? Okay, thank you very much. Thanks. Okay, we're moving on to item number 4, which is our police department report. Chief Moorhead.
Good evening, everyone. Jim Moorhead, Chief of Police. And for the month of May, we are at the midpoint of the year, and the police department is tracking normal to the past couple years. We're just below 16,000 calls for the year at the moment, which is right on track. For the month of May, the police department handled 3,284 calls for service, of which 2,338 of those were in the borough. We saw Part 1 crime, which is our serious crime. We had 31 Part 1 crimes for the month of May, and we had 96 Part 2 crimes. The largest majority of Part 1 or serious crime came from the area of assault. We saw quite a significant increase in assaults. If you could go to the next slide, Bill. Yeah, there we go. So you'll see assault in blue was 2020. Obviously, this time last year we were shut down. And 16 for the month of May is a little bit below normal, but still too high for our standards. On Part 2 crime, the significant is going to be DUIs continue to be an issue. The month of May, we had 6. Again, we typically track about 50% of that, meaning, we'll typically see 2 to 3 a month, and we've been seeing a steady 6 or so each month. Public drunks are back up, and vandalism is back up. Just the crime report for the month with the Quiet Downtown initiative that was taken on about a month and a half ago. We've had some success with that. I think everybody is in agreement that it is an extreme uphill battle trying to combat this issue, but we've put a lot of effort into it. For the last just under 45 days, we have had 6 actual cited violations for actual noise complaints on vehicles. And, we have to remember that a lot of this program has been educational. So the officers have been making a large number of stops, and a lot of those are discussions and to provide education that we want the motorcycle community to feel welcome in the borough. Want the sports car to feel welcome in the borough. We just want them to act appropriately. So we have those discussions, and there's been a number of other citations issued, but specifically dealing with noise, there's been 6. A lot of those other issues would be, an example, stopping a motorcycle for a loud muffler, but it didn't rise to the level or didn't meet the standard of a citation, but the operator wasn't wearing eyewear. They were cited for the offense of not wearing eyewear, which is mandatory in Pennsylvania. So just an example of how our officers have been. It's been received well. We've seen mostly positive remarks on overwhelmingly positive remarks on social media. Channel 29 was out today doing a story on it. And if you notice, the signs were taken away today. So they were claimed back from the provider. They're getting prepared for another initiative. That doesn't mean that the police department's stopping its efforts. We're still going to be uptown. Just the shift in streets is going to be evident. On another topic, we're pursuing new hires. If you remember, at the end of 2020, we held off on one spot till June of this year. So we're in the process of doing backgrounds at the moment to hopefully hire for that position. And also we had a vacated position in April. An email went out to council and borough manager and assistant borough manager and the mayor. So we're looking to fill that void as well as the June spot. So backgrounds should be completed by the end of June. And the mayor will be doing interviews in mid-July, and we expect to bring names to council then. The last thing I'd like to mention is the police department is launching a new initiative on camera registration with citizens. So we're doing a citizen camera registration. It'll be pushed out through all of our social media and will be posted on the borough website here shortly. So please keep an eye out for that. That's going to give residents who volunteer to register their cameras with the police department. Does not give the police department access to their cameras. It just lets us know if we have a crime in a specific area that we're able through GIS mapping to be able to see what cameras are available as potential investigative tools. That's my report.
Would they be, you're talking about like the Ring cameras on people's doors, that sort of thing?
Yes, Ring cameras, Eufy, Arlo, any monitoring camera that would cover something of interest to the police department, then we would encourage the community to register and just let us know that could potentially be available to the department if needed.
Yeah, I think it's a great idea with the cameras. Yeah. Mr. Scott, anything? The only question I had was the speed sign. For lack of, is that what we call it? What just tells you you're going this fast, or that we call it the speed sign? I don't know.
Yes.
Yeah.
Yep.
Do we know where that is, or if they have a rotation set up for that?
There is a rotation. I know Corporal Malicki in the resource unit has been hard at work. He just completed traffic study in the 100 block East Rosedale Avenue for truck traffic. I I can't tell you at the moment where the speed sign is, but it is on a rotation, and I believe it's about six locations deep right now that are pending. Do you have a specific request?
I always, the loop right in front of my house, but South Franklin Street in general is just kind of like a speedway sometimes. So it's always, even near Greenfield or whatever, like anywhere on that South Franklin Street is always speed because there's no stop signs.
I take that every day. I know exactly what you're talking about. I'm not a violator of it. I witness it.
Good, because I have a camera out front. So, does anybody have anything else for the police department? Okay, thank you, Chief.
Thank you.
Moving on to item number 5, which is our Good Fellowship ambulance. Chief Bergen, there he is.
Evening. Good to see everyone in person finally here. So, Good Fellowship in May did 509 calls, total 135 of which were in Westchester Borough. If you scroll down a little bit there, you see really the weekend volumes picking up again. That tells us we're returning to our normal call volume. Typically, June, July, and August are our slower months on a normal year. Not sure if we're going to see that this year. Our volume has been pretty high the last couple months. So. Other than that, really nothing else abnormal for May there, other than returning to our normal volume. Outside of that, we're really winding down our homebound vaccine program. We've been doing that for a couple months now with the Chester County Health Department. We've vaccinated probably about 75 homebound residents, not just in Westchester, but around the county as well. And really going into special event season, 5Ks, the borough events now, so planning for that. Other than that, really nothing else for Good Fellowship, unless you have any questions for us.
Gentlemen? Okay, anybody have anything for the Good Fellowship? Okay, perfect, thanks. All right, we're moving on to item number 6, which is to discuss a resolution to create opioid and overdose mitigation committee as a committee of council. I think Mayor Norley, you're going to take this one, right?
Yes, I'll set the stage a bit. So there's 2 primary ways to create a committee when it comes to our borough government. One is as a kind of a permanent committee of council, or an ad hoc if it's solvable, I guess. And then also a mayor's kind of quote unquote task force. Now there's pros and cons of each. As far as the mayor's task forces are concerned, they're really informal. The mayor just says, okay, appoints whoever they really want to a task force, and continues that really as long as the mayor wants to, or perhaps there's a new mayor and they don't want to, as long as it's a priority of the mayor at the time. So that's one, not subject to sunshine law. And then there's committees of council, as we know. Committees of council are voted on as a resolution from Borough Council, asking the solicitor to create the ordinance that then creates the committee of council. Those tend to be permanent unless council then says, we vote to dissolve this committee. It's a more formalized process. There's interviews, by council, and appointments, specific terms, term limits, those sorts of things. So both this item with regards to the overdose issue, as well as the next item with the town gown issues, we're asking for council to consider making these committees of council so that they are, we believe that they're both vital issues that should be ongoing, and there should be ongoing attention, and there should be ongoing committees, really, because these are major issues that aren't going to go away anytime soon. A lot of benefits come out of specific attention to them. One of those, like I mentioned, is the overdose issue, and I'm going to have Kyle speak to that.
Hi, my name is Kyle Hudson, 524 West Marshall Street, and I was a member of the Mayor's Opioid Action Task Force. I have some statistics for you. Back in 2017, the year before this task force was created, we had 144 people die in the county. In 2019, before the pandemic, excuse me, yeah, in 2019, before the pandemic, we had 104. And I think that that number reduction, almost, a third, is because of the hard work that a lot of people did, the organized efforts that we did across the county. And I can speak to the fact that the Westchester Mayor's Opioid Action Task Force was consistently ahead of the curve and was a model that the county looked to for a lot of their efforts. I think we've seen that by concentrating on this issue and dedicating time and resources, we can actually make an impact. We're talking about the lives of our neighbors. So I think we need to create something that can be a permanent fixture to help people suffering from addiction in this town, whether it's opioids, methamphetamines, whatever is the current crisis needs to be dealt with. So I really ask that you consider this. I worked with a lot of members from the Mayor's Opioid Task Force to put together an ordinance for the mayor. And I just think that this is something that we really need as soon as possible, because every month we wait is more people suffering, because those are the numbers of people that just died, right? There's tons, literally countless more people that are suffering, and they need our help too. So please consider forwarding this up to council. Thank you.
Mr. Perrin, what kind of resources are needed for this? I mean, besides just setting up the committee, does the borough have to allot funds or anything? I mean, is there any other resources that are generally poured into this?
Well, typically, committees have staff, at least one staff person assigned to a committee. So I'm not sure who that would be, department that would be. Yeah, I mean, I saw this on the agenda. It's always been a mayoral committee, and I was just wondering, as Kyle just said, they've done a pretty good job. So I'm not sure the motivation is to change that committee to a council committee. Is this a function of the government or the county has a opioid? So, how much money we're talking about? Budget. But in order to create a council committee, excuse me, that has to be done by ordinance. So that's the process anyway.
Yeah, I guess my biggest question would be, I know Mayor Norley talked a little bit about the pros and cons, but what would be the major pro to, like, what difference would this make it for, in terms of like what you're able to achieve and accomplish if this was a committee as opposed to a task force?
Again, a task force is subject to whatever the mayor wants. If a mayor no longer wants a task force, the mayor it's no longer a priority, it can just cease to exist. When I came in as interim mayor, Mayor Herron closed down the opioid task force and sent out an email saying it was closed down. So I haven't since had the bandwidth to go back and even recreate it. Now, I've been working with the opioid task force folks to figure out what the best path forward is. And it seems like we shouldn't have that sort of situation going forward. It's a similar thing to the Campus Community Coalition. This is a very, very effective organization and committee in the past. And it was no longer a priority to the previous mayor. And, to each their own. Maybe they have other priorities, whatever. There's certain things, there's certain realities in this community that shouldn't be subject to a change of mind by one individual. And the motivation is simply to have a permanent place to continue to address the opioid and overdose issue, as well as the next topic, which is the town-gown relations, and working together in that capacity.
Gentlemen, your thoughts?
Uh, So here's the story. I think you explained very well the governmental organization aspect of the various options. But, you know, I don't have a good feel for what the task force has done, what it's expected to do. And I wonder, can I ask Kyle about that? Would he be the guy to talk to?
Yes, in relation to this.
Unless you want to respond to it.
You know, no, I'll give it to Al.
So what do you want to know?
I'm having trouble hearing because this room bats around sounds like a indoor basketball court. Can I ask you to take your mask off?
I am not going to take off my mask, but
What?
I'm not going to take off my mask.
You're not willing to?
No.
The only reason I ask is,
I can speak
So-
louder.
let me finish. So I could see your lips, I could understand better. But, okay, go ahead. So let me ask you, how long has the opioid task force been up and running?
As far as I know, it was the first thing that Mayor Herron did when she was elected mayor in 2017. So it's January 2018.
That's about 2 or 3 years?
Almost 4.
Almost 4 years. Okay, and you've been on it that whole time?
Yes, I was there at the very first meeting. It was actually something that I worked very hard to get accomplished.
So tell me, what's been done by that organization, that committee?
Yeah, so the way it worked previously was we had a monthly meeting here in Borough Hall, and we had stakeholders from around the community. We organized a quarterly event focusing on different things, right? So one month it was focusing on the psychology of addiction and the medical parts. Another event was a focus on resources for family members, right? So we tried each quarter to have something different to target a different group of people with needs, right? And we partnered with the Chester County Health Department and several other groups. We were participated in the Color Run, which raised money for the Narcan distribution that the county does. And I just want to point out that Ethan Healy, who is a member of Good Fellowship and is the person responsible for getting Narcan in every police car in Chester County, is a Westchester resident, and he's a part of this committee. So we're very privileged to have him. And he's been a huge driver in that. And actually, before the organization ended, we were doing 2 initiatives. We were working on including Narcan distribution to the businesses in town, because people are overdosing in town, and the more access people have to Narcan, the less people die. And then we were also focusing on constructing a sober schedule, because someone who's a recovering addict or someone who's recovering from addiction, they can't go to a bar, right? Even if they're recovering from heroin addiction, they're not going to go to a bar, which is like 90% of everything we do here in Westchester. So the goal was to kind of coordinate with different organizations and groups in the community to create a sober schedule so that every night of the week, someone could go do something in town that didn't require being surrounded by people drinking. So those are just some of the initiatives that we did. I know there were plenty more. I know when she was mayor, State Representative Herron worked and got the receptacle downstairs to take in drugs off the street, which has been huge. I mean, one of the biggest ways people get access to these drugs is because they're in someone's medicine cabinet. Well, because of the opioid task force, we got funding for that. I don't remember exactly how it was funded, but that has taken off. And the chief may be able to say how much drugs have been recovered through that. Do you know? A lot, right? He's shaking his head. So I feel that it's one piece of a larger puzzle, right? The county is operating, but consistently, the feedback I've gotten from State Representative Herron at meetings was that we were always the people they were looking to, right? We were the ones that were doing events and they're like, oh, that's cool. We should do something like that, right? And I think we should be a leader here in Westchester on this issue, because we have a lot of neighbors that are suffering with this, and they're not all going to come out and raise their hands and say, I need help. People need to know that their government has their back, and then if you need a lifesaver, there's no shame in asking for, if you're drowning, there's no shame in asking for a life preserver. And I think that by taking this on as an official government organization, it helps in the main goal of this, which is destigmatization, right? This is a disease. This is something people need help to recover from. This is not something that we should be punishing people with, which is why I'm really glad how involved the law enforcement has been and how sympathetic they've been to these causes. So I think that this is a great next step. I think it's the evolution of the work. I think that, when she was mayor, Diane Herron put 3.5 years into this, right? Do we want all of that work to just get brushed aside? I think we've invested the time and resources already and we've seen positive response from it. So I am asking that we continue the mission.
Thank you, Kyle. How many were in the group?
The group was sizable. It was about 15 people. I think the committee that we are suggesting is 9 with specific positions that we outlined.
How long has it been since it's been defunct?
September. Our last meeting was in September of last year. And just another statistic, it was down to its lowest level in 2019. We saw an uptick, a small one, last year, but the biggest change was in demographics. Traditionally, it's been 18 to 24. Last year, we saw a rise in 45 up, right? And I think a big part of that was because that population wasn't around, right? The 18 to 24 folks, they were somewhere else. So I don't think we should take that statistic, that small uptick, as being indicative of that it wasn't as bad, because I think it was actually pretty bad last year when people didn't have access to their support networks and stuff like that. So, I mean, we're never going to hopefully have to do something like this again, what happened this last year, but having that infrastructure in place for folks is so important, so that when people have that moment of clarity and they can see, I need help, that we're right there to help them, right? Because sometimes that's a fleeting moment.
Were there any reports along the way created and
I don't believe there were any official documents that were created or generated by
anything
the
at the end, the closeout kind of?
No, you'd have to ask State Representative Herron about any kind of formal closure documentation.
That would be helpful in my understanding of exactly what's going on. And is there let's say, a county report about the opioid crisis in Westchester about?
It doesn't break it down specifically on the municipality level, but the Chester County Coroner's Report, which is where I get my information from, it's pretty comprehensive. They or at least since Dr. Vanderpool took over, they've broken out individual drugs, what's been right. And one of the biggest things that I do want to highlight is that, this entire time, opioids, fentanyl has been the reigning problem, but we're starting to see a rise in methamphetamines, right? And that's why it needs to be something that is also flexible to deal with the next crisis, right? Because according to Ethan Healy, an expert in this field, every 5 to 10 years, we have a new drug of choice, right? I mean, how long ago was we were watching Breaking Bad, right? Everything was crystal meth. And then before that, it was ecstasy. And then before that, it was crack cocaine. So, addiction is something that's pervasive in humanity. And as a government, I think we need to provide people resources to help themselves get out of it.
Thank you.
I have a number of questions, actually. And I ask these from having been involved with alcoholic and drug detox and rehab a number of years ago. Now, aside from, this will sound a little sarcastic, I don't mean it to be, but aside from having meetings, what specifically are you going to do? Are you going to have contact with people that have a drug problem?
So I think one of the best tools, and I neglected to mention this, that we did was create a website that kind of collated all the resources, right? So providing resources for people and providing, here's how you get here. Because right now, if you're suffering from addiction right now, you're supposed to call, you call in and they ask you if you have insurance or not, right? And there's it's a very complicated process. And if you go on the website, I think it's WC Opioid. Yeah, it was built here by the borough, and it provides tons of resources for folks. We also literally put Narcan in people's hands and provided these locking jars through the county, or I don't even think it's through the county. I think it's through a private organization. I think Casey's. something like that. They provided these bottles that you could lock your pharmaceuticals in that make it impossible for people, like it's like a safe for your drugs. We provided real tangible things. And, these meetings, you say it is just a meeting, but when we did our one on Thanksgiving, that was the one that was always the most meaningful to me because not everyone has a support network, right? And I think sometimes, especially the families of these folks, right? There's tons of resources out there for people suffering from addiction, but sometimes you feel so alone. And our events provided a community space where people could come and see, that's my neighbor who's going through this too, and realize they're not alone. And I think there's value in that, right? Even if it's not something that there's a report and I can't give you exact statistics on how that impacted people, I think providing those human connections, especially after the last year we've had, is so important for these folks. We need to be doing whatever we can to save lives. And I think this is really a low investment, high return, a very high ROI, right? If we just coordinate resources and provide help for people, you save one life, I think that's worth it. But we were able to knock it down. And again, this is not just us, this is a coordinated effort across the county. We were able to knock it down by a third in 3 years, right? So that's just because we focused on it. But we're not focusing on it anymore, right? COVID has sucked the air all out of the room. So, I mean, we've provided tangible efforts, tangible things.
What services, I mean, the county has a program, the state has programs, there are a lot of private programs around. What would this committee do that they are not doing, number one? And number two, you don't take people off the street. If you're going to be dealing with people that are like the addictee, let's say, there's no way I want someone off the street dealing with them. I want someone that's had some training in this. And what sort of training, I mean, this sounds great, don't get me wrong, but people got to know what they're talking about because drug addicts, alcoholics, they become so manipulative in a lot of ways, and they know all the tricks to tell you what you want to know. People are going to need training for this, and I just have a feeling that this is going to be duplication of existing effort. I might be wrong, but it comes across to me like that. And in addition, I wonder whether that's something that, and I like the concept, but I'm just wondering whether that's something that needs to be dealt with at the borough level. I mean, I can see getting out, basic information and the websites and all that, but I don't think borough funds should be spent on something like this. And if they were, people would have to be trained. They would have to be, kind of an official organization. I can see doing this as an ad hoc committee. That makes a lot of sense. But as a formal program, to the extent that I think you would like to do it, I just don't think that's the province of local government.
So if I could answer your two questions, which were the training of the people involved and what are the direct benefits that we have to the people of the borough.
You
correct?
said training would be involved?
No, what is the training that was involved, right? So no, I don't claim to be an expert in this. I'm just a guy who did a bunch of research, and I would never stand in front of the group and tell people what to do. Every single one of our events, our public events, were supervised and included trained professionals who spoke, right? I think the only person who ever spoke that wasn't someone who's an expert in this field was when then Mayor Herron was introducing the crowd, right? The whole point was to draw those resources into the borough. And that's what people get out of it, right? Having a addiction seminar at the Melton Center is very valuable because a lot of the people over there, they can't hop in their car and drive down to Devereaux because they don't have transportation or they're relying on public transportation. And a lot of times people don't even sometimes think they have a problem, right? And by talking about this on a local level, it can bring these, like by beating that drum, right? And talking about it on a local level and saying, as a community, this is something we care about. And we will be able to use this committee to draw in those trained professionals, those resources, and apply them to folks who may get overlooked at the county level, right? Because let's be honest, all of our statistics aside, people look on the county as Westchester is like, oh, they probably don't need as help as other municipalities in the area when it comes to something like that, when we all know that's not the truth, right? So I think that having an advocate, a strong advocate, will allow us to bring those pieces in. And as far as duplicating efforts on the county level, I mean, while we have some of the same people involved, and we will have hopefully a member of the county health department on the committee, they can't be everywhere, and their resources are stretched incredibly thin. Like if you were to call tonight and to try and get a bed at one of the recovery centers, you can't, right? So what do you do? What do you do?
Okay, another concern, although not at this point, but let's say this were to go through. We would need a staff person to, a borough staff person to handle the committee. And at some point, we're going to be asked for money. Well, I won't be on council when that happens, but that will happen. And how are we going to know that this is successful? Number one, how are you going to test it? How do you prove the results? I mean, it's great from a PR standpoint that the borough cares, which we do, but money's going to be involved at some point. And is that money going to be well spent? Of course, I don't know how much it would be, but that will happen. So, like I said, the mayor's ad hoc committee, I like that idea. Frankly, I haven't really seen any reports, which you alluded to know what they've done or what they haven't done. So I'm like this right now. Okay.
I would just like to point out that there's lots of grants. There are lots of grants and public funding for these kind of initiatives. We never asked for, I mean, we never spent any public dollars for our initiatives, I don't believe, outside of maybe some money for the reciprocal downstairs. So, I mean, and we were able to do that with on a shoestring budget, right? I'm not asking for any funding at this point. I think right now we need to lay the groundwork, get it going, set up the infrastructure and lay out the mission. But I understand your hesitancy, but this is something that I think is, I mean, addiction is going to get worse, not better, right? If you ignore it, it's not going to go away on its own. So we can rely on other people to do it for us, or we can take some initiative and handle our own backyard.
Okay, let's say you have your meeting and let's say it's your first meeting and, you come up with the goals, all that sort of first meeting stuff. Then what do you do? Are you going to be going out in the street to, spread the word or what? I mean, is this going to be, I'm assuming it's going to be volunteer. First of all, where are you going to get them? Are they going to have the appropriate amount of time to put into a project like this? It's the sort of thing, if you're going to have a meeting, you don't just have meetings every month, and I'm not saying this would happen, but you just don't have meetings every month and talk happy talk, and, it looks good in the newspaper. So that's a concern I have too.
If I could just speak to that, the people I've met in this, I'm a weird person. Like, I don't have a specific connection to anyone who's in recovery or anything like that. Almost everyone else it is. And when you're in this because your kid died, you're going to give it everything you got, right? These people who are participating in this, it isn't for the glory. It's because they know how bad this is. And I promise, think on how bad this is in your brain. It's worse, right? And that's the bad part of this. And the good part of this is, like, well, we will have no shortage of volunteers that are dedicated to this mission. This year we've had 27 people die in our county. That's 27 families that are ready to do whatever it takes to make sure that never happens again. So I don't think you're going to have to worry about passion in volunteers or like accomplishing the goals that we set out to do. We just need a guiding light. And I think that's what this committee could be.
I think from a standpoint of education, getting the word out, that's phenomenal. But I have a real problem with actually dealing with the people that are having the problem unless you've got appropriate training. And like around here, I don't know where you would get that, but I would have
And
to-
again, the committee members aren't going to be interacting with the public. The goal is to create events that people can go to that are managed by organizations like the Chester County Health Department. But we can make sure that they happen in town, right?
Okay, all right, thanks.
I'd like to see if anybody else has any comments on this. Yeah. Mr. Allen?
Good evening. I missed the beginning of the conversation, but I just wanted to give my 2 cents here. I was lucky enough to go to, I think, 3 of the events that were put on by this committee. And, you get into politics to make a difference in your community. And I find being on council, I spend a lot of time talking about fee schedules and street sweepers and all that kind of stuff. And those are all super important things. But these events really, I mean, admittedly brought me to tears. One of them, it was something I didn't know much about. I was very ignorant on the subject. And just as a citizen of the borough, being able to go to the Lasco YMCA and gain an understanding of this issue and interact with people who have been touched by the issue helped me personally understand what's at stake. And it kind of gave me a whole new admiration and respect for people who are working on this issue and are going through the issue as a family member or someone struggling. And I work with a couple moms who lost sons, and it helped me understand a little bit better what they went through and helped me relate to them a little bit more. But what I think I was really blown away by, there was an event over at Everhart Park. And it was actually seeing the community of people who have gone through these issues come together. You could tell it made a world of difference. And I think it's worth any effort we can do as a borough, because that's why we're here, is to help our community. So I would like to see us do this. Thanks.
Anybody else? Mr. Flynn?
Sitting in the back of the room, I had a chance to listen to Mr. Hudson, which I always find very interesting. He always brings a different perspective to what's going on in the borough. I did hear him say that they reached out to a lot of people and supplied Narcan to people that needed the drug to survive, which is very important. I have a problem with citizens touching that product unless you're a professional and know how to use it. I don't think the average resident should have anything to do with Narcan. But we do have professionals in the room here that could give us some history, because when 911 is pushed, you do see, good fellowship and the police department going to the site to administer help. And they would be the best office to be able to tell us, how bad the situation is and what the situation relies on. Because from what I understand, the police cars have Narcan. And of course, Good Fellowship is always on the job, no matter what happens, whether they get paid or not get paid. And I think those are the 2 agencies that we should look closer at before we start up a whole new borough-wide committee. As the ad hoc committee, as it sits now, Mr. Hudson, at the helm of it now, what Mr. Braceland said, I believe that they're doing a great job, but I don't think it should be part of borough government unless the police department and Good Fellowships thinks we should. Thank you.
Thank you, Mr. Flynn. Anyone else? Okay, so at this point, where are we standing in terms of, are you in favor of pushing this to council, or?
Well, I asked my questions, but I thought we should have a discussion among committee members. On the one hand, we have very, say, tragic circumstances that abound, and Kyle has explained them. And also, Councilman Flynn, I guess Bernie's on the same page, brings up the same question. So I I'm hesitant about adding to the borough code by ordinance a standing committee to address the opioid problem, the catastrophe that we have. I'm thoroughly convinced that it's a problem. It's a big problem. We hear it all the time at the national level. But if there's anything we can do to help, we should. But I need more. So I would, I'm just taking notes now. You know, we do have mental health. I don't know what the committee is called, but there's a private mental health 501c3 organization. We have AA. Now, this is not an alcoholic addiction, but it's surely an addiction problem. And we have the Chesco Health Department. I've been looking at their website here, but I just have to know a little bit more about how such a committee can help. I mean, if we're talking about one-on-one outreach, Bernie raises a good thing about, you know, you shouldn't have Narcan in your pocketbook to whip out. So I'm not saying that such a committee can't do good things, but frankly, if it's been up and running for 4 years and there's no paperwork on this and the mayor just shut it down, that doesn't speak well to me. You know what I mean? I'd like to know what was happening. I mean, here you see let's take the first responder hospital folks, the first aid folks. You know, every month they tell us what's going on and how many are in and out. Now, I wouldn't put such an onerous task on any borough committee, but gee, I'd like to have seen something over that period of time. I'm not, you know, I didn't come here to be anti helping out with this project, but I must say I don't know what we've done up to now, and I don't know what we can do. A committee for the sake of a committee, to me, is counterproductive. It takes time that we could use for other reasons. I'm not worried about the money. It would be, I believe it would be nickels and dimes, but it takes time and it takes volunteer help. And I want to be sure that it's the right way to do it. I'm not naysaying the need and the tragedy of the crisis, but I'm sorry, but I haven't been convinced that we should put together a committee to do something about it.
I'm in favor of this, but I agree with your point. I think you gave us a little more credit than we had. We didn't know all the things that we got asked a lot of questions. What are you guys doing for this? And we needed some concrete answers, and it'd be nice to have presented that tonight and said, hey, this is exactly what we're doing. And like I said, I'm still in favor of it. But I would have liked to see that myself. Like I had the same questions that Don and you had. Like what do you plan to do? And I've heard some of those things, but it would be nice to have a little bit more concrete, maybe even a visual or something like tangible to look at. So I'm in favor of it. Doesn't sound like you both are at this point. Is this something we could table to wait for more information for next month and then revisit it?
Obviously, the committee would get together and come up with a plan and so forth. But I'd like to have some idea of what maybe could be done and what the thoughts are. And I would like to find out from the Chester County Health Department how this fits in. So that's why I would table it. I'd like to get that stuff in for next month.
Uh, I was in healthcare pretty much my entire career. There's very little I didn't see. There's very little I didn't do. In a broad spectrum of healthcare, I did a little bit, you name it, I probably did it. And I just, based on my experience, I'm just uncomfortable with this.
Mayor Norrie, you want to, we're trying to wrap this up, by the way. We're way over time.
Understood. Just 2 quick points. One, I do think it's really important, and you have first responders in the room. I do think it's very important to have Narcan in the pocketbook, in businesses. Now there needs to be some level of training, but that is what's key, and time is of the essence. And, part of the low-hanging fruit, I think, is getting Narcan in the hands of the businesses and restaurant community and get them properly trained. And there's grant funding available for that. And Ethan Healy certainly speak to that, is one. Two, the nature of a formal committee is that there is a record of things that are done. There is a record. There are meeting minutes. So what you're asking for actually would be part of the committee going forward. But because it's not a formal committee, it hasn't been a formal committee in the past, that record doesn't actually exist.
Thank you. So,
I would like to
to,
make one-
can you give me a second, Kyle? Thank you. Would you like to table this? It's being tabled. So we're going to stop discussion for tonight.
I
and
do
we're
need
going
to
to
put
table it
something
for
on the
next month.
record.
I would like you to, I think you talked enough tonight, Kyle. Thank you.
With all due respect, I just want to say.
I understand, but I'm asking, I'm saying that we're done discussion on this.
Said that Narcan.
Kyle,
okay.
we are done discussion on this. Please have a seat. Thank you. Okay, so we're going to move on. That has been tabled till next month. We're moving on to item number 7, which is discuss a resolution to create a community campus coalition as a committee of council. I feel like we're going to have similar discussion on this, but Mayor Norley, go ahead.
You can go ahead and table that if you like.
I feel like it's a good idea, just considering the timing and everything else.
Yeah, I mean, it's a similar discussion as to the pros and cons of having a standing committee. This one does have a lot of record to it. There are minutes and such going back before it was disbanded a couple of years ago. That the university puts a lot of resources to it, including paid staff and such. And there's been a tremendous work product that's come out of that. And it's really important to keep working with the university. We've already seen some benefits of that in the last month or 2 months with having conversations personally with Chris Fiorentino, the president of the university, about the issues of having student housing in West Goshen near South Matlack Street and Rosedale. And he called up West Goshen and said, you know what, we no longer support student housing in that area because of that conversation. West Goshen, since because of that conversation, removed student housing as an option in that area. So these sorts of dialogues and working together with the university on joint efforts, such as mitigation of the alcohol effects in the college areas, homecoming, coordination, all sorts of issues like that. This is something that really needs to be a standing committee and benefits the community significantly. That being said, I know we're running over, and we can just table this to next month. There's no real rush to that if that's.
I would prefer to table it just because I would actually like to have some discussion on this as well, and I just don't think we have the time for it tonight. If that's okay. Yep. Yeah. Okay. Okay. So we're going to table that as well. I'm looking forward to that discussion, though. I am. Okay. So item number 8 is discuss potential of a social worker support unit for the Westchester Police Department for 2022.
This is going to be really short. Just want to bring it up that we're looking at that as a potential option for 2022. We would consider a social worker or mental health kind of unit, an individual. We're currently tracking a couple programs that are in other places to get some learnings and see what may be beneficial to the police department and the greater community from having somebody that could, pay attention and track and case an issue, help navigate a reoccurring problem to the appropriate resources, somebody that would have a relationship with the county, state, and federal government, somebody that can help to, that's a professional in the field, help to train and help police officers internally, as well as debrief from issues, things that can be done better, as well as potentially even respond to a safe situation and help to, mitigate an issue for somebody that's really, trained in that area. This is something that, as we've talked about, 44 officers is the full contingent. If we end up making a recommendation, and again, this is just this is preliminary, very preliminary. We would make sure that this would be a cost savings as well to the borough.
Okay, so there's no ask tonight. It's just a discussion. Okay.
We all support this, especially.
Yeah, it's true. I do support it. I think it's a great idea. No. Yeah.
But
Yeah.
I think the mayor's head of the police department, I think you can unilaterally without council's approval, as long as there's no budget implications. If there's more money that needs to be allocated, then comes a budget question for budget process. But other than that, I think the police department to.
Well, I
But-
believe,
but- but-
in this case, that it would be a non-union member. It would be, like how dispatch is set up. I'm not sure how exactly that's structured.
So it would be an administrative position,
Well, it wouldn't be an
but
officer
outside of the union.
outside of the union.
Gotcha.
So that's where I kind of get a little sticky.
Yeah.
Okay, so. Yeah. Okay, so there's no ask there. Or just, okay, thank you. Okay. Moving on to item number 9, which is approving our May 2021 minutes. They look good to me. Very, very detailed, gentlemen. Yeah, okay, this is 3-0 on that. Is there any other business? Okay, I'm seeing none. We are adjourned. Thank you.